It's October, Breast Cancer Awareness Month, and everywhere you turn, there's talk about early detection, screenings, and healthy living. But there's one thing we hardly ever talk about: the air we breathe. Could it be that something as invisible as air is quietly increasing our risk of breast cancer or hypertension? Let's test that for a moment. Here's a quick one for you. What's one thing that can float through the air, raise your blood pressure, and damage your body cells even before you feel a symptom? Is it sugar, stress, or smog? If you guessed smog, you are absolutely right. And that's what we are diving into in this episode of Clean Air Report Ghana here on Joy 99.7 FM. This is the Clean Air Report Ghana on Joy 99.7 FM, your weekly deep dive into how air pollution is affecting lives, livelihoods, and the fight for a healthier Ghana. In today's episode, we look at how dirty air is doing more than just clogging our lungs. It's also fueling breast cancer and hypertension. We'll hear first from Jennifer Ambule of the Chronicle newspaper. She uncovered powerful stories of market women battling breast cancer while working in toxic environments. Then we'll speak with Caleb Ahinakwa, whose report reveals how Ghana's hawkers, breathing in exhaust fumes all day, are becoming silent victims of a growing hypertension crisis. Jennifer, this is a powerful story that connects air pollution and breast cancer in such a personal way. What made you take on this topic?
In other countries, there have been established research that air pollution is linked to breast cancer. But in Ghana, as I speak, there's no research done. However, it's the same air everywhere. I also realized that we don't talk enough about the air we breathe, which affects women's health. We often focus on breast cancer awareness, but we don't really talk about the environmental risk that comes with where women live and work. So I decided to visit Agbogbolohyi because it is the most polluted place in Accra. I saw how women were working in smoke, some from the fuels, from moving vehicles, and I kept wondering what this pollution was doing to their bodies. And I wanted to show that, breast cancer is not just about cancer, it's about survival, and the right to breathe clean air also matters.
You opened with Ifwa, a breast cancer survivor still working at Agbogbolohyi Market. And I must say that
Yes,
Agbogbolohyi is one of the most polluted hotspots in the entire country. And this is
yes,
backed
please.
by data from different institutions. I mean, how did you
Mm-hmm.
find Ifwa and what stayed with you most from your conversations with her?
I roamed Agbogbolohyi for like 3 hours. I wasn't finding anybody, you know, and some of them too didn't want to speak. And it was difficult, but I saw if were through someone who knew breast cancer survivors who were still working in the market. When I met her, she was already arranging tomatoes and all that. So she agreed to tell me her story, which was full of pain and courage. She told me that after her surgery and chemotherapy, she still had to come back to the same market so that she'd be able to feed her children.
Now, your
Yeah.
piece draws a clear line between environmental pollution and cancer risk. When you began reporting, did you already suspect that link, or did the science and interviews with the experts change your understanding along the way?
When I started the story, I knew the air at Agbogbolohyi wasn't clean. That is an established fact already. But I didn't know how dangerous it really was until I measured it myself. So I used a small air monitor, which was donated by Open Seneca, and the data was analyzed by Clean Air One Atmosphere. It showed pollution levels between about 10 and 68 microgram per cubic meter, which was way above WHO safe limit of 5. So this means that people there breathe air full of cancer-causing particles every day. So after that, I also spoke to Dr. Nana Amawadi from Kolebu Teaching Hospital, who confirmed that most breast cancer cases they see come from Accra, which is also one of the most polluted parts of the country. And she said that what is really worrying is that more young women are being diagnosed often with aggressive type of cancer and may still report late for treatment.
So, Efwa's story and that of other traders like Doris, as you also
Mm-hmm,
mentioned,
mm-hmm,
highlights how survival and danger coexist for women in these markets. What
mm-hmm.
moments during reporting hit you the hardest emotionally?
The hardest part was seeing how normal the danger felt to them. You know, Doris told me that by the time she gets home, her nose is even blocked from dust and her chest hurts with headache, but then she still goes back every day. And when Ifwa said, every breath here feels like danger, that was very deep because it's more like they know what is happening to them, but then what can they do?
Wow. Now, after doing this story, what do you think must change, both in public health and in how we talk about air pollution and women's health?
You know, we need to start linking women's health with environmental health. You know, breast cancer awareness shouldn't only go by screening. This month is Breast Cancer Awareness Month, so they should also talk about the environmental risk for women. So as they are doing this, I think government must also enforce emission laws. Yeah, that's what I think should be done.
Thank you, Jennifer, for reminding us that clean air isn't just about climate, it's about women's health, survival, and justice. Now let's turn our attention to another story, one that hits the streets, quite literally. Caleb, your report focuses on hawkers battling hypertension in the chaos of Ghana's polluted cities. What drew you to this story and why tell it now?
And this group of people I'm referring to as hawkers. And I was drawn to it particularly simply because, first off, if I am generally just being affected by moving about in a vehicle or maybe just walking, what about those who usually work around these places? These individuals that spend 24/7, I mean, most of them spend 24/7, morning to evening, Monday to Sunday, on this particular road. They are in between roads, they are on the pavement, they are chasing cars to get their goods sold, and it's worrying really. And so I just wanted to tell their story because it's rarely told, and they are rarely spoken to when it comes to these issues.
Now, I guess that brings you to the next question, right? You
Mm,
open with Nanama's powerful story. I mean, how did you
yeah.
find it and what was the process of getting her to share her experience with you?
Right. So Nanama is actually a neighbor. I have known this particular lady in my area for close to 6 years. And I mean, I know how she has struggled to make ends meet. After going through this training, I decided to reach out to her to find out because there are times when I noticed that there are times when she doesn't go to work. And so I thought to assume she was being lazy. At some point, I thought she was just being lazy. She's not lazy. She's been battling certain ailments, and that's actually even pushed me further and I mean intrigued me some more. And I realized that times when she doesn't go on the streets is simply because of her health. And I spoke to her further, and I did realize that I mean she's been visiting the hospital a number of times simply because her blood pressure has been increasing. And she always thought it was because of the pressure these kids always bring.
So, from what I get from you, she rather explained her high blood pressure to the pressure from her kids and not necessarily
Exactly.
from possibly what she was exposed to.
Exactly. So she didn't know until the experts let us in on it. So obviously along the way I had to go with her to the Achimota Hospital. That is where she actually works. That's the Achimota Hospital around the police station. The doctor enlightened us some more. She didn't believe that just working on these stretch and inhaling a lot of these pollutants will shoot up her blood pressure. I mean, she thought these number of kids were worrying her so much that her blood pressure had gone out of control. So yeah, we took that bold step.
So beyond Nanama, you
Mm,
spoke with doctors and drew on some research. What were some of
yeah.
the most striking things they told you about the link between air pollution and hypertension?
If we should go back in time, there's been a lot of documented evidence put together that draws a link to how hypertension is affecting our informal sector. The research was around our informal sector, and really, when I brought that attention to the doctors actually told me that actually when these patients actually come visit them, they tell them that they ask them their line of work first, and they try to explain to them to find a shop or something rather than apply this particular roads, to get off sell off their goods. But you know how if you know our informal sector very well, I mean these traders and hawkers, they are very stubborn. One thing that struck my attention from my engagement with these doctors is, with these excuses these hawkers give, these hawkers forget that if they were supposed to live, let's say, some 10 years more, being hypertensive reduces their lifespan.
I think that answers the question about the economic cost and the economic considerations that some of these
Mm,
people are making day in, day out to determine whether to expose themselves or to cut the
mm.
exposure to themselves. But looking ahead after putting this together, what do you think needs to change most urgently, whether in policy, public health, or awareness? I mean, to
Mm.
protect people like Amma.
I sat back and I was like, okay, I've told the story. So are we going to see any changes? Are we going to see any impact? There's a lot to be done, and I refer to that particular approach as a all hands on deck approach. Why do I say so? This is where we need, the lawmakers. This is where we need, a lot of these health practitioners. This is where we need the hawkers themselves to understand that they matter to us, they matter to their families, they matter to themselves as well. So left to me, we should rather protect these hawkers. If there's no way to make money, and I mean, this is the only way to do it, let's protect them. I mean, during our training, we found out that there's a particular, is it the N95 mask, the nose mask that, at least is more efficient than the regular nose mask. If we are to help actually provide these hawkers with masks, these N95 masks, and make it compulsory for them to put it on as they work around these roads, I think at least we could find a way we could make a little step towards progress.
I'm grateful. Thank you very much, Caleb. I'm guessing that you are suggesting that the government takes the step to
Mm,
help them to protect themselves. I'm also guessing that
definitely.
that will mean also that government should also could take steps to reduce the pollution in the first place, and then
Mm,
they'll be protected at the end of the day. I'm grateful again, Caleb Ahinakwa.
a pleasure.
Is one of the fellows on the Clean Air Fellowship Program. Thank you, Caleb, for shedding light on how air pollution isn't just an environmental issue, but a daily health emergency for thousands of workers on our streets. And that's where we'll leave it for this episode of Clean Air Report Ghana on Joy FM, where we follow the fellows investigating how the air we breathe shapes our health and our future. If you found this episode eye-opening, share it with a friend, drop us a rating, and keep the conversation going, because the air we breathe is too important. I am Michael Ashali, and this has been Clean Air Report Ghana on Joy FM. Thank you for listening. And remember, every breath counts.